Okay, now we're moving on to the last thing. That this is really a totally new thing that we're offering here at the center. I say that as if it were brand new, but the fact is we've been doing IV nutrition for over 30 years here at the center. Every year we do over 3,000 IVs safely right here at the center. Dr. Riordan, who was our founder, once estimated that he had personally ordered over 70,000 intravenous vitamin C infusions during his professional career here. And just recently, this past October, we hosted an international conference symposium on IV vitamin C with over 8 countries represented, and we're scheduled to have another symposium this October. So we are leaders in this growing field of IV nutrition. And so today, what we have, I'm going to be the information guy to tell you about this. I've been here at the center about 21 years, and I've probably had about over 200 IVs myself. And my wife, who was diagnosed with breast cancer about 9 years ago, has probably had over 400 IV vitamin C. So we know that the IV vitamin C is very safe. But for a lot of people, when you hear about IV nutrition, you kind of wonder, what is that all about? And so to kind of help us clarify the procedure and how it's done, I'm going to invite our new CEO, Brian Riordan, to come up and be the volunteer. And Marcia, our head nurse, is going to start an IV on him. And while they're doing that, I'm going to ask them some questions and kind of interview them so that you can kind of get an idea. First of all, I'd like to welcome Brian. Brian, you come from New York these days, right?
That's right.
Yeah, he's a native son. Dr. Riordan's, let's see, there's you and Quinn are the 2 twins.
Right.
And then there's Neil and Michael and Teresa and Renee. Okay. And so, Brian, you've got an MBA that you got in Japan, is that?
Paris.
Paris. Wow.
Yes, I lived in Japan for a long time.
Okay. And so, what was your experience growing up working under your father as he was starting the center?
Well, specifically, I remember a lot of pioneer work going on in IVC. Dad was a particular fan of Linus Pauling, who a lot of you may remember or know as the real leader in the benefits of understanding what vitamin C does for us. And Dad pushed the limits for using vitamin C in a clinical setting. As I understand it, you can digest about 6 grams through your gut, and not any more than that effectively per day. So if you take 12 grams, you still only got 6, the rest went elsewhere. But with the IV, it can be much, much more than that. And I remember, probably when I was in junior high, the first time they did 80 grams intravenously, which sounds like a lot. And actually the guinea pig was my dad, which is usually doctors test on themselves. The first time it was a success. It was kind of a little bit of hand-wringing, a little bit of nervousness at the time, but now it's a accepted and very popular therapy, growing in popularity every day. That's what I remember about this particular thing.
Yeah. Okay, we're going to go ahead and Marcia's going to go ahead and start an IV on Brian. And you've had him before. Go ahead and hold on to that. I'll ask some questions.
Okay, great.
I want to tell you all just a little bit more about IV vitamin C, because a lot of people say, how could you possibly think of putting a needle into a person and giving them vitamin C in these large doses? How is that natural? But the interesting thing is that all creatures make their own vitamin C except humans, primates, and guinea pigs. Right. And so why? Well, it turns out that we actually do have the genetic structure to make the enzyme that converts glucose into vitamin C. But it has mutated and it's no longer active. And so we cannot make our own vitamin C, but every other creature, when they're stressed, injured, sick, any type of challenge to them, their livers or their kidneys will start making large amounts of vitamin C. A goat, which would normally make about 2,000 milligrams a day, if it's seriously injured, can push that up to around 40 to 50,000 milligrams per day, which most people are not aware of, but there's very good evidence. And so what we're doing when we do IV vitamin C is we're actually restoring back to humans an ability that has been lost in the distant past. It's helping you adapt to whatever stress, cancer, chronic illness, injury that you might be having. It's used in some hospitals in burns units. It does promote faster healing of injuries. We use it for like spider bites. It'll heal a spider bite very quickly. It works very well as a natural like antibiotic. It'll help you get over an infection quicker. And so what we're doing tonight with Brian is kind of a miniature IVC. This is called the IV Essentials. And you can take a look on your sheet here, but the IV Essentials does have 5,000 milligrams of vitamin C in it. It also has some vitamin B5, and the reason we like B5 is because you need that for your adrenals to work better. And in our day and age, with the amount of stress that we all have to cope with, you really do need good adrenal support, and vitamin C and B5 are very good for your adrenals. It also has a good dose of vitamin B6, which along with B12 and folic acid, which is in the B complex, can help you methylate. And methylation is very important in terms of protecting your arteries and detoxifying the liver. Magnesium tends to be very depleted because of the diet that we have. We eat a very refined diet here in the United States, which depletes magnesium, makes you more prone for muscle spasms, heart irregularities, and fatigue. And then calcium, of course, can be beneficial in terms of your muscle, your heart function, your bone function, all these various things.